guys sound great. You look fantastic. Hey, I just am so excited. This first session was awesome, man. We just set the stage for this amazing day of learning about carbon composite AFOs. I want to introduce my friend of 2.5 decades, Bryan Schloss, Director of Sales and Marketing at Trulife, and also want to introduce Josh Mullins, Business Development Manager with Trulife. Josh and I also go back 2 decades at least, Josh, something like that.
Yeah.
Mm-hmm. So, really excited to hear what your offerings are, what the presentation's going to entail, and capitalizing on that first session and how, Trulife has and what they have to offer. And big shout out to Trulife for their support of this educational effort. Take it away, fellas.
Thank you, Rich. Thank you, Rich. This morning's sessions have been amazing, informative, on AFO point. There's nothing else like this in the industry where so many different aspects of the AFO conversation can be pulled all into one conversation. So kudos to you, Rich and LER, for hosting the event and putting on this platform for us. We appreciate everyone spending the time with us on Saturday morning. Great topics and conversation by Eric, Rebecca, and Spencer this morning. The next 30 minutes is entitled Advancing Mobility, the Evolving Role of AFOs in Patient Care. You're going to be hosted by yours truly, Bryan Schloss. I am the Director of Sales and Marketing for Trulife, and Josh Mullins, my co-presenter, my co-host, and he is the Business Development Manager for Trulife. Together, we have over 50 years of experience in the O&P space. The session itself is going to cover how AFOs restore function and improve gait for your patients, which will be a great tie-in to the presentations we heard this morning, and who benefits from AFO intervention, another tie-in from the presentations we heard this morning. And we will also talk about why Trulife. What's the difference between Trulife and other manufacturers in this space? And what's the difference between our products and other manufacturers in this space? And finally, we'll end on the PACE line, which is our current line of AFOs, world-class, top-of-class PACE AFOs. Can't wait to share the information with you guys. I'm going to now turn it over to my co-host, Josh Mullins, and he's going to take us through this next section.
So let's go ahead and talk about understanding AFOs. Well, first off, what is an AFO, right? Ankle foot orthosis is one of the most commonly prescribed orthotic devices in clinical practice. It's designed to support the ankle with the foot, particularly in patients with muscle weakness or neurological conditions. Ultimately, the goal is simple. It's to help patients walk more safely and more efficiently, supporting that ankle, giving them that strength, that confidence that they can move forward, giving them that function that brings them back to an active way of life, right? We want to keep them mobile. And that's kind of what we're looking to do here. So why are they needed? Well, typically you're looking to stop or prevent toe drag, as well as improve foot clearance and stabilizing the overall gait pattern. So with patients as with conditions such as drop foot, the biggest challenge that they often have is that swing phase within the gait pattern. And without the support, they're going to obviously drag their foot. And so we want to kind of give them that energy return that's required to give them that mobility and that ability to move forward. So what does the AFO actually do? Well, the idea, it's going to provide that stability, it's going to maintain that alignment, and it's going to assist with that energy return. The energy return is critical for them to actually experience that complete gait cycle as they're going through their daily activities. So the patient challenges. When we look at the different patient challenges and what's coming down the pipe, there's a significant impact within the baby boomer generation. There's 10,000 people that are going to be turning 65 by 2030. And so with that, you're going to experience a greater need for these devices. 15% of the baby boomers are actually affected by diabetes. In turn, is going to obviously affect their overall health. This is higher than in any previous generation. So what does that actually then mean for your patient population? When looking at the products that you have for your patients, you want to make sure that you're obviously giving them the right patient, the right product, the appropriate product. And with the patients that are coming down the pipe, most of them are dealing with all sorts of different conditions within the diabetes leading to neuropathy. National studies estimate that 13.5% of the U.S. population has neuropathy. Research teams have uncovered that despite patients having symptoms, neuropathic pain, 75% went undiagnosed, which leads to amputations oftenly, right? So what we want to do is keep them moving, keep that body active, and get them into a device that's going to alleviate these different pressures that they are experiencing, these different challenges that they might be going through, and keeping them moment. Behind all of these different statistics is actually that patient that's in your exam room. And as a clinician, as you're seeing these patients, as a provider, you have to make what makes best sense or practical sense for them. A lot of these patients that are dealing with that neuropathy, the peripheral neuropathy, are dealing with that ischemia issue. And by keeping them mobile, keeps them confident, keeps them active. And we want to keep these things moving. So who's your ideal AFO candidate within your practice? These patients are already patients that you're seeing in clinic. You're seeing them weekly. So the question then becomes, what do you do for them? Now, some of you might be writing a script and sending it out, right? And sending it out to your local orthotist. Others might be fitting these in-house based on what they have, what's available to them. Others might be on the fence, not knowing what to do, right? Should I do it in-house? Should I send it out? But in reality, as the providers, you guys are in turn in charge of their overall healthcare, making these decisions, right? So when you write a script and you do send that out, you're not necessarily really knowing what exactly it is that they might be receiving. And so you lose that a little bit of autonomy, right? And so I think that when you're looking for right cases, these are the types of patients that you'd be looking for, as already been spoken of. Drop foot, diabetic peripheral neuropathy, post-stroke, those who have partial foot amputations, gait instability, those who have high risk or neurological conditions. And when you're looking at these patients, some of the key indicators, as we've already discussed too, would be that drag, that toe dragging, that foot slapping, you can say the hip hiking, also the reduced dorsal flexion that's going on within your patient population, or the reoccurring falls. Falls are going to limit them from being able to have the confidence that they need to live independently. And so we want to make sure that they are able to be mobile and active within their environment, within their daily living. So why Trulife? And talking about Trulife and the different AFOs, I'm going to go ahead and pass this back over to Bryan so he can talk a little bit about Trulife as the organization.
Thank you, Josh. Appreciate it. That was awesome, informative. Yeah, this next section is going to cover why Trulife, a little bit of history of Trulife, and talking about our 30 years of experience in the AFO space. Okay, who are we? Trulife has a strong reputation for manufacturing safe, simple, and reliable devices. We're a global entity. Trulife is widely known in the categories that we specialize in to manufacture the highest top-of-class products at competitive prices, and we're very, very consistent and good at it. Leaning into the presentations from this morning, something that Trulife prides itself in is manufacturing products that are highly patient compliant. Today, a big topic in our industry is patient outcomes. Everybody's monitoring and watching patient outcomes. We feel at Trulife, we have a responsibility in producing products that have a high patient compliance so that better patient outcomes can be achieved. We feel the two are very much connected. Thank you. Next slide. Yeah, so Trulife has a rich history in the medical supply space. In 1958 was the origination of Trulife. We were the first to the global market with the external silicone breast prosthesis, the first globally commercially manufactured and marketed breast prosthesis for women that have had breast cancer. In 1987, Noel Murphy from Dublin, Ireland, purchased the company and moved the international headquarters to Dublin, which is where it is today still. Our CEO currently, Olive Gunning, we're all very, very proud of our CEO, Olive. She's one of the few female CEOs in the O&P space, and she's a tremendous asset, not just to our company, but the whole industry. Thank you. Okay, the product assortment from Trulife is vast, and I'll go through this. I'll zip through this. But orthotics, we've really gotten to a point where we specialize in a few different categories of orthotics. Rather than having everything for everybody, we've really narrowed it down over the last decade or so. Carbon fiber AFOs is our space. We are global leaders in that space. We also have some very good spinal products as well, global leaders in spinal products. Prosthetics, feet is our expertise, is our warehouse, K1 through K4, K3, K4 feet, as well as modular components. Aluminum modular components with a 350 weight capacity and they're black, anodized, painted black. They're beautiful, they're sexy, and they function really at a high level for the patients and the practitioner. Breast care, global leaders in the breast care category, both in off-the-shelf and custom. That's where we started our business, and still today we're one of only very few manufacturers globally in this space, and it's absolutely one of our specialties. The next two squares on the bottom left, seating solutions and pressure care. These are pressure relieving products, mostly sold in Europe, but you'll find Trulife products in the OR for lengthy surgery. Surgeons use our products to prevent ulcers through lengthy surgeries. These were very big products that we sold throughout Europe during COVID. I'm very proud of Trulife's participation and involvement in that space. Walking aids is all in the UK. I call this the bent metal category, canes, crutches, walkers. Globally, this is a hard category to be profitable in, and our UK entity has broken the code and does a lot of business with the NHS there on walking aids. And finally, the bottom right square is the most, I think, the most important square to talk about, because it's something that most people don't know about Trulife. In our 75,000 square foot state-of-the-art facility in Bellingham, Washington, the same machines that manufacture our modular adapters and feet also make high-tech componentry for the aerospace and Department of Defense industries. So we have small customers that are like, Northrop Grumman and SpaceX, small companies. We make a part that is on the F-35 Raptor that patrols NATO, patrols Europe for NATO. We make a part that is on the SpaceX rocket that goes to the space station and replenishes the space station for our astronauts. We also use the same high-grade level of carbon fiber composite materials that go into Boeing airplane components that we manufacture as well in Bellingham, Washington. Thanks, Josh. So the global impact is vast. We have manufacturing facilities in 3 different parts of the world. Bellingham, Washington is where we make all of our prosthetics and orthotics. And as I said, that building also houses tests, Trulife Engineer Solutions. Dublin is where our all of our gel silicone knowledge is housed, and we rock it out in Dublin for 75 years with our gel silicone technology, top class in the world. And Sheffield, UK, where we proudly invented the carbon fiber AFO category in 1995. This is not hearsay. It's not somebody that this was not something that was told to me during training. I was there. I was hired in 1995 in the US at Camp Healthcare, and that Trulife had acquired during that period of time as well. And very proudly, confidently to say that we were first to the global market and still are top of class in the AFO space. And last, but very much not least, Jackson, Michigan is where we have our US distribution center. When we purchased Camp Healthcare in 1997, Camp's footprint in Jackson, Michigan dated back to 1908, nearly 100-year icon at that time in 97 when we purchased them. Okay, the Pace line. How did we get here? Josh is going to be talking a little bit about the Pace products itself. My next few slides are going to cover how we got to the Pace product development. As I've stated very proudly, humbly, we were first to the global market in 1995, Sheffield, UK. Matrix, and I believe someone in the chat column earlier had mentioned our Matrix products. Matrix is our legacy product. It's still available today in the market. It was first to the AFO carbon fiber AFO space. I think, as Eric mentioned in his presentation, prior to 1995, when carbon fiber composite AFOs were invented by Trulife, it was all about posterior leaf springs. And those PLS AFOs locked up that calcaneus heel structure. Today's world with a carbon fiber AFO is just a whole new world for gait improvement during the rehab process. So what we took everything that we've learned from the Matrix experience and put it towards the research and development of the Pace line, which we're going to be talking about next. Okay, very integral piece of the story. Dr. Abraham Lizama is a world-class expert in carbon fiber composite materials. He's a graduate of Sheffield University, which is also widely known for their carbon composite fiber knowledge. Sheffield University is where F1 pulls their carbon composite fiber material knowledge from. They're majorly into the global space of carbon composite. Very proud of our Abraham Lizama. Lastly, before we advance to the next slide, I'd love to share that while we were all on our couch during 2020 and watching Netflix during COVID, Abraham went to work. He put his head around backwards, and he for 2 years researched the AFO space. So before, I like to say the world didn't need another AFO at that point. So before we manufactured the next generation AFO, we really wanted to study what was existing, not just from us, but all the manufacturers globally. He also, Abraham, studied 1.2 million shapes of feet. He studied how the angle of the strut should come up off the foot plate. He studied the manufacturing process of the AFO itself and developed a way to have one layer of carbon fiber material instead of two that are married up at a point that becomes inherently weak, where the foot plate meets the strut. So on our Pace line, it's all one layer in the layup of carbon fiber material, and there's 22 layers of carbon fiber materials in our Pace line of AFOs, all made by hand. There's no machine here, all made by hand in our Sheffield, UK facility. Okay, material science. What Abraham has done for the AFO category, bringing the material science knowledge to the space, is bar none top of class in the world. Also, as Eric alluded to earlier, I think it was in the information session, the Q&A, our AFO has passed the 2 million cycle test, thereby qualifying for a 2-year warranty. And quite frankly, we think it could go further. But we only tested it up to 2 million and it passed, and we're good. We are achieving a 0.00001 delamination rate, which statistically is 0. Reason is there's several different reasons why that's being achieved. One of which was discovered by Abraham during his research, that if the strut comes up at an 82-degree angle off the foot plate, then that will greatly reduce the tension and unnecessary tension that happens on that strut during the normal gait cycle. We've broken the code. Ours doesn't delaminate. And at this point, I'm going to turn it back over to Josh, and Josh is going to take us through the specifics on the Pace line. Thanks, Josh.
Thank you, Brian. So as you can hear, there's a lot of research that went behind it. It wasn't as if we are looking to send this product out and have it made in a different country. We like to control what we can control the controllables. And that's what we're doing within our facilities with Abraham and the team, with the hand layup, with the 22 layers, with the right carbon fibers, with the right composite, with the right resins. That's what we're going to get into.
Engineered for every step, the Paceline. Designed for support, flexibility, and energy return, the Paceline delivers anterior and posterior carbon fiber AFO solutions catering to a wide range of patient needs. UPACE, a universal carbon fiber AFO designed to adapt. Featuring a precision-fit posterior strut design with medial and lateral configurations, UPACE is a single-size AFO designed to promote dynamic walking in patients with drop foot or up. Trim-to-fit footplate enables fast in-clinic customization. An adjustable calf band allows clinicians to tailor to the desired height for the individual patient anatomy. Magnetic application improves the ease of use for both clinicians and patients, delivering the trusted dynamic support and energy return of the pace range. One solution designed to adapt. The Paceline, anterior and posterior carbon fiber AFOs from Trulife.
So we can see that we've done a lot of different steps to get us to where we need to go, not just for Trulife, but for best outcomes for the patient population, right? The research that went behind the design of what we have today is going to give you a very broad range of persons that can be fit and you could use this device with or for, okay? Every device was engineered specifically with the patient in mind. When you look at the anterior strut design, it's lightweight. It has a 2-inch ability to be adjusted within that anterior shell. Your energy return, that footwear compatibility, as well as it's anatomically going to fit the patient. And we're going to talk a little bit about that too. When you think about the footwear, as others have talked about, what's key is for them to use the product, right? It's not what can I put on them, but what's going to be effective in the patient actually using. And they don't want to be restricted. People are people, I like to say, and they don't want to be restricted with what they're able to wear or what they're able to do. And I think that when you consider the AFO that Trulife offers, you're going to see that it's adaptable, it's comfortable, it's form-fitting, it's going to give you the right amount of energy return to allow that patient to be mobile. They're not going to be limited with footwear. Well, maybe I should take that back. Not for high heels, right? Let's take that back for a second. But you're going to be having a wide range of footwear that's available to them, and it's not going to limit them. Now, so looking at the Pace family as a whole, it's great for people that's supinate with the strut on the medial side, because we have the lateral side, we have the medial side option. The strut being more posterior within the AFO itself reduces potential rubbing on any bony prominences, as the malleolus said. These designs were tailored specifically for that patient. When you look at the calf strap, it's a flexible, comfortable, breathable pad that's it's allowing it to be washed and cleaned. With the carbon fiber itself, as Bryan was talking about, looking at it from an aerospace type grade carbon fiber without it breaking. And I think oftentimes there's different challenges that patients would face with the amount of use they have within the product itself. Now, our product has no weight limit. So you're going to be able to have that flexibility, that strength, that durability. And if there's something that was to happen within that device and that 2-year warranty time, it's going to be taken care of. And we want to make sure that the patient is being taken care of. Nobody wants to feel as if they're being left behind. Give them that ability to have the freedom and the autonomy to be part of the program, right? To get back to work, as the providers mentioned. It's important for them to feel as if they're part of that community. Some of the key features, as I talked about the A-Pace, is that adjustable anterior plate. It's customizable and formable around the tibia. It's going to have a 2-inch ability to adjust proximal, distal. It's an ergonomical design with a foot plate that can actually be formed and shaped to be able to fit into the shoe right. You're going to have lesser SKUs with this product because there's a couple sizes that can be modified or customized, I would like to say, to that patient and what you're trying to accomplish within that patient's goal. Being that it has that Formula One aerospace grade carbon fiber, again, feeling confident that that patient is going to get something that's durable and it's going to last. When we look at the latest and greatest, we found that there would be appropriate product to have in the space, which we call the U-PACE. This is more of a universal posterior carbon fiber AFO. Now, because it's universal, I don't want to go down the path as one size fits all. I don't know if I would fully say that. However, what I would say is with this design, you're able to customize, you're able to modify it to fit one size fits all many, right? As far as tailoring it according to the patient's needs, according to the size of the foot plate, to the size of where the calf should be, or the calf strap should be within the strut. And so you have now an option that's going to even reduce even more of that inventory ability by using something like this that can be customized and tailored to that patient, giving that patient a precision fit with that adjustable calf strap on the strut, with the ability to configure the side you want, whether it's a medial or a lateral side option, tailoring that foot plate and allowing that patient to have a good experience. The other thing that's really beneficial on our A-PACE as well as the universal is our magnetic closure system. This is really important because it allows them to don and doff the product if they have dexterity issues. There's a pull tab that's a magnetic closure system that gives them that, again, freedom to be able to don and doff the product with one hand. Now, if you're doing this as far as in-house, when I say fitting these patients in-house, if you're taking these scripts and writing out your script and sending it out, or whether you're considering it, they're all viable options, right? And what does that look like? Well, if you're entertaining the idea, there's profitability within it anywhere from $700 to $900, depending on the state and the reimbursement, right? And if you're sending it out, if I could make a suggestion, the suggestion would be if you find that this device is a good option for your patients, I would just encourage you to write that on the script. Write it on the script for the current orthotist to be able to fill it with the current product that you are recommending, the one that you're learning about. If there's a product that you want us to share or show your orthotist, let us know. We have no problem doing that at all. The benefit of this is that you're also controlling the controllables. It's that patient outcome that you're looking for. You're not having that necessarily outsource. You're not going to lose that patient to follow up. You're able to kind of see them practically through the process to see how that device is working, to modify it accordingly. There's great benefits to that. Now, with that, I'm going to pass it back to Bryan.
Very good. Very good. So why Trulife? First and foremost, we are all about the patient. People matter at Trulife, quality without compromise at Trulife, and we have a high level of integrity. Let's keep moving, Josh. I think we're almost out of time. All right. So we're going to go in this very short video. It's about a 1 minute and 30-second video is going to show Danielle, who's an MS patient, walking in our AFOs. And the video speaks louder than any words that I can say. You're going to see several things that Danielle does in the video that were formerly contraindications for AFOs, carbon fiber AFOs. Just watch what she does in the PACE AFOs. Go ahead, Josh. Very good. Very good. Okay, so we've made it to the end of the 30 minutes. We're almost right on time. I've got just this last final slide that we're going to put up with contact information for Thomas Larkin, who's our U.S. sales and marketing contact. tlarkin@trulife.com. He is your one-stop shop for answering any product-related questions, setting up your account with Trulife. I also want to give a shout out to SureFit, who we are a preferred vendor of. So those of you that have accounts with SureFit, all of our products are available through SureFit, anything that you've seen here today. We also offer fit kits for the AFOs. Those are also available by either Trulife Direct or through SureFit. And I also want to say here that all of Trulife products come with a 60-day clinician evaluation behind them. So try them out. Podiatrists, orthotists, try them out. We feel very strongly that you're going to like them. Your patients are going to like them. And rather than sending them back in within the 60 days, what we see more frequently is a reorder within 60 days. Thank you all very much for listening, and appreciate your time this morning.
Awesome. Man, that was fantastic. Truly appreciate our partnership, our friendship. You're talking 25 plus years. Your journey, my journey. We've crossed our paths in our lives for a long time, and I know we have a long road to walk together. Thank you to Trulife for their support of this conference. I have put up 3 polls. You guys have been awesome in answering those polls. They're in the chat. You could click the chat, click on the poll, vote now, and just put in your info. If you'd like someone from the Trulife team to contact you, please pop that in there. And also, if you're interested in attending a future AFO reimbursement masterclass, we got something in store for you coming up in the fall, which I think you're really going to like.
That's going to be hot, Rich. That's going to be hot.
That's going to be crazy, dude. It's going to be awesome. And I'm really, really excited about that as well. We have so much planned, and appreciate your partnership. We're going to move on to the last session.
Thank you, Rich. Thank you, everybody.
See you all later.
Thanks, Josh.
Take care, guys.
Thank you.